Welcome. I'm Claire Rickinson. Thanks so much for joining me for this short presentation of my research proposal, examining the potential role peer coaching could play in increasing the amount working adults practice mindfulness after attending mindfulness training. Let's start with some context, what is already known about this topic and why it's worth studying further. So if we zoom out for a moment and think about the environment adults have been working within over the last 40 years, as this visual illustrates, working adults have been experiencing increasing levels of complexity and fast pace of change. And as you can see here, a number of strains are being placed on working adults at the moment. And a burnout epidemic has been identified, which has been found to be decreasing productivity and performance. So, of course, a key question organizations are asking is how can we address burnout and support employees to thrive within complexity? Now, one intervention that has proven to be effective in combating burnout is mindfulness. While up until around 10 years ago, most of the research studies into this area lacked rigorous design, and so the findings did not have strong validity. More recently, there have been some randomized controlled studies using objective data to measure the impact of mindfulness, and the findings are compelling. You can see here some examples of some of the benefits that have been identified from practicing mindfulness. So as a result, organizations have begun investing heavily in helping employees to build the skills through offering training and access to apps, etc. However, the transfer from learning to practice is disappointingly low. It is only estimated to be at best around 10 to 15% as a transfer. So for organizations, the key question is how can we actually improve that? How can we help motivate employees to practice these skills which have been proven to help them in addressing burnout? In seeking to answer this question, self-determination theory is particularly relevant. So self-determination theory was developed by Deci and Ryan in the 1980s and has subsequently, they've built on that, as have other researchers. And self-determination theory argues that we have three core intrinsic needs: autonomy, a need to control; competence, a need to feel that we're getting better and we're mastering something; and thirdly, relatedness, a need to feel meaningfully connected to others. And these core psychological needs lie at the heart of our intrinsic motivation. However, what Deci and Ryan argue is that our environment is as influential in enhancing or thwarting these needs. Therefore, organizations play a really influential role in either increasing or decreasing motivation to practice new skills. So, what interventions enhance skills practice is the critical question. Now, one intervention that has been found to be promising in certain settings in actually increasing motivation to practice and develop new skills is peer coaching. So a peer coach is an individual who provides informal support and feedback to a colleague who is seeking to develop and grow. So it's informal, it sits out of the formalized hierarchical performance management system. It's a concept that was born in the 1980s, and it's predominantly been used in patient healthcare and educational settings. And it's in those two settings where a number of randomized controlled trials have been conducted that have proved that this can be a very effective intervention. So let's look firstly at the patient healthcare setting, where there's been a range of studies that have been done, which have found, firstly, there's been an increase in healthy eating behavior. So in diabetic patients, in overweight college students, It has also led to an uptake of preventative health screenings. And interestingly, in one study found that the support provided by peers was as effective as clinician coaching support. And two other studies found that peer coaching not only positively influences the coachee behavior, but it also impacts the coach as well. So it has that double benefit there. So lots of evidence for a increased behavior change, positive behavior change within the patient healthcare setting. Now let's look at the educational setting. Here, there's been two studies that have specifically looked at skills practice level, and both of them found that when an individual has a peer coach, they are more likely to practice new skills and also more quickly master them. Another study looked at what is it about this relationship that is more effective than perhaps a manager employee coaching relationship, and they argued that it was removing the power dimension. So you've immediately got more of that trust there and connection because of them being peers. So let's now look at the organizational setting. Well, interestingly, peer coaching has not been studied independently in organizational setting. And that is really because the manager is the primary giver of coaching and feedback in organizations. So there's been many studies that have looked at the impact of managers coaching and providing feedback to employees. And interestingly, the results are quite mixed. The outcomes reveal that it is highly dependent on a trusting relationship existing between that manager and employee. And that is actually really hard to be established because of the inherent power imbalance in the system there of the reporting relationship. So it's fraught with challenge, and the research would indicate organizations cannot rely solely on managers to fulfill that role. And therefore, there could potentially be an option to use peer coaching. But at the moment, it is not known whether those findings from patient healthcare and educational settings are generalizable into the organizational setting. So therefore, this study seeks to test for the first time in a working adult population whether having a peer coach increases practice levels of mindfulness in working adults after attending a mindfulness training session. So let's look at how this question will be answered by looking at the study design. So a randomized controlled design has been selected as this enables for better controlling of extraneous variables so that causality can be established. So looking at the first step, recruitment via advertising, the target number for this study is 120 working adults across a diverse range of professions, ages, and locations. They will be volunteers recruited through a range of professional and social networks, advertising an opportunity to learn mindfulness. All will take part in pre-screening, and an informed consent will be obtained. And then all eligible participants will be randomly assigned either to the control group or the treatment group. Now, this will be a single blind study, meaning that those in the treatment group or the control group won't know which group they're in. And this is to prevent the risk of the results being artificially inflated in the treatment group. So both the control group and the treatment group will go through separate training, but the training will be identical in that they will both be learning a mindfulness technique, in a virtual 45-minute session, and they will both be set the goal to practice at least once daily and record their practice times for the next 4 weeks. In the treatment group, they will also be introduced to the concept of a peer coach and asked to appoint a peer coach. Then at the end of week 2 and at the end of week 4, all participants will be surveyed. Those in the control group will be asked to report their recorded practice levels, and those in the treatment group will be asked to also record their practice levels, report their practice levels. and also report the number of interactions they've had with their peer coach where their goal has been mentioned. So that will enable us to obtain frequency data that will then be analysed. And then at the end of the study, all participants will be offered the opportunity to debrief and will be sent a report of the findings. So let's now look at how the data collected will be analysed in order to draw some conclusions. So the main research question in this study is whether having a peer coach leads to increased practice levels. In order to answer that, the null and alternative hypothesis will be developed, as you can see here, and then an independent sample t-test will be conducted to determine if there is a difference between the mean practice levels in the control and the treatment groups, and whether that difference is statistically significant using an alpha of 0.055, meaning if the p-value is greater than 0.05, the null hypothesis will be rejected and the alternative hypothesis will be confirmed. The data collected will also enable a second research question to be tested, which is whether more interactions with a PC lead to higher practice levels. So again, the null and alternate hypotheses will be developed. And to test these, the total recorded practice time for each participant in the treatment group would be calculated by adding together their week 2 and week 4 survey responses. Then the total recorded number of interactions with their peer coach, where their goal was discussed, would be calculated in the same way. Then those results would be mapped onto a scatter plot graph, and the Pearson correlation coefficient will be calculated to determine if a positive correlation exists, and the strength of that would be reported, as you can see here on the slide. Now, this is just an illustrative example of if a positive correlation were to be found, what that visually would look like. In closing, while this is a relatively small scale study, it begins to address a significant gap in the research in working adults in an organizational setting. And if peer coaching were to be found to be effective in increasing practice levels of mindfulness, this represents an immediate, practical, scalable solution to address a very pressing need organizations have, which is how to effectively build new skills within employees that will combat burnout and enable them to thrive within ongoing change and complexity. And here are my references.